Can forensic pathology use infection signs post-mortem? Imagine uncovering clues after someone has passed away that tell a story of illness or infection. Forensic pathology can indeed use signs of infection seen after death to help figure out what caused or contributed to death. When a person dies from an infection, their body often shows specific changes that forensic pathologists can spot. These include microbiological evidence, tissue damage, and chemical markers that reflected the immune system's fight against infection during life. During an autopsy, samples of blood, body fluids, and tissues are collected and tested. Culturing these samples can reveal bacteria or viruses that were present before death. For example, bacteria like Enterococcus species can be grown from blood samples and linked to infections that may have led to death. But interpreting these results requires care because bacteria can grow after death, making it tricky to tell if they caused infection or just contaminated the sample. Pathologists also examine tissues under a microscope. Signs of infection such as inflammation, pus, or tissue destruction can be seen in organs like the lungs in pneumonia, the heart in infective endocarditis, or in abscesses. These changes are evidence that the immune system responded to infection before death. Sometimes, biochemical markers like C-reactive protein, which the liver produces during inflammation, can be measured after death. Elevated levels support the idea that an infection or inflammatory process was active before death. However, after death, bacterial activity increases as tissues break down, leading to decomposition signs like skin discoloration, bloating, or marbling. These post-mortem changes can mimic infection signs but are caused by bacteria acting after death. Forensic pathologists must carefully distinguish between changes caused by infection during life and those resulting from decomposition. Because the immune system stops functioning after death and tissues change rapidly, interpreting infection signs requires experience. Combining microbiological tests, tissue analysis, and chemical markers helps determine if infection was a cause or a contributing factor. Working with microbiologists and clinicians helps clarify whether bacteria or viruses found were present before death or simply contaminants. In practical terms, recognizing infection signs after death helps establish the cause of death, provides important public health information, and supports legal investigations. The immune response during life leaves traces that forensic pathologists can detect and analyze, helping answer key questions about how and why someone died.